Hi, I'm Paul. Why would a 77-year-old man produce a video course on the healthcare system from an insider's perspective? The answer is a strong passion from both a personal and professional perspective on the subject of health. I also have a strong commitment to freedom and truth. Our founders pledged their fortunes, life, and sacred honor to give us these values as the foundation of our country. They understood that without a clear moral standard, all other roads lead to ruin. Truth is especially important today as disinformation permeates our whole society. Today, only 10% of people believe social media health information to be true and reliable. I've developed a unique and comprehensive course on health and the healthcare system. It explores how to use and access the healthcare system for maximum benefit. It also addresses the affordability crisis we're currently experiencing in healthcare. This course will tell you the truth and provide clarity about healthcare. The information will be presented responsibly and carefully. It will be a guide through the current maze of healthcare. It is practical and full of common sense. It will also be useful in understanding the many proposals for healthcare reform that are currently being debated. Healthcare really is just about you, the patient. Providers are the means to the end. The best primary care provider is often the consumer. The current system has an overutilization incentive. However, there are alternatives to this approach. The course explains the many benefits of the consumer taking responsibility for their health. Also, it will show why insurance should be focused on catastrophic needs and should allow patients to benefit financially from wise healthcare decisions. Today, too many MBAs are maximizing loopholes in regulations and place excessive emphasis on the bottom line. The moral foundation of the system is crumbling. The care and compassion, as characterized by Mother Teresa, is becoming rare. More than 60% of all MDs support euthanasia as an option for everyone with 6 months to live. I want to share my 50 years of professional healthcare work as well as my personal experience with the system. I'm familiar with the dilemma of having to scramble to find affordable healthcare insurance for my family. I've had experience with the behavioral health system and learned much about the best way to utilize it when necessary. I've worked in developing government health policy, been a medical school faculty member, an Army medic, and a management consultant to healthcare providers for over 50 years. The course will be very helpful to the average consumer as well as those more familiar with the system. It will help to better understand the many confusing and conflicting aspects of the system. The course will be concise. It will challenge you to think deeply about your health and how you relate to the healthcare system. Some topics that will be covered are the following. What is health really? Is it a right? The theology of health, health and personal responsibility, elements and history of the health system. What is primary care? What are the options for primary care? CPT medicine and its negative incentives. The miracle of the triple tax benefits of an HSA. How did government take major control of health? What is truth intention And how do we live with it effectively? Malpractice and its effect on overutilization, population health, and value-based care, basic health economics, preventive care, the wellness movement, the addiction to debt and its implications for healthcare, DEI entanglement and its negative impact on quality, the elusive search for ultimate behavioral health, other expense sharing options for health insurance. Along the way, many interesting and unusual facts will be revealed and discussed. For example, the U.S. spends over $11,000 per capita annually for healthcare. Switzerland is second with about $7,000 per year. Most other Western nations are closer to $4,000 per capita. The U.S. has a life expectancy of around 75, while other nations are higher at close to 80 years. What is the difference between healthcare and medical care? Why do health leaders say that despite medical care taking the lead, it plays a minor role in total health? Tax deductibility obviously favors the wealthy. Medicare and Medicaid have flooded the healthcare market with generous finances. Has this promoted an atmosphere of greed? Should tax deductibility be capped? U.S. healthcare is a paradox of excess and want. Some areas of the country consume 60% more resources than other parts for the same diagnosis. How and why has this happened? Does it make sense to pay for health problems caused by others' neglect and abuse? Should we be able to decide what is included in our catastrophic health insurance policies? Why are healthcare prices rarely available? A requirement to post them has been in effect for over 7 years. Is malpractice reform possible? Reasonable reform could reduce healthcare costs very significantly. Does the current monopoly on hospital beds make sense? Are grand pianos in hospital lobbies logical in light of the inequality of health availability and debt? Why is a Medicare MSA plan listed in the Medicare catalog but isn't available anywhere? Why do we depend so much on medical care instead of making wise healthcare choices? Why Medicare patients are technically borrowing from their grandchildren up to 30% of their medical care? Would hospital marketing dollars be better spent on promoting school choice to more better address a key and basic determinant of health? In summary, this course will provide the tools to get maximum benefit from your own healthcare system. It's designed to provide a truthful view of healthcare. It will provide you the resources that will change how you access and respond to the healthcare system. It will change your life. It's hard to place a value on the health course. This is especially true in light of just paying my plumber over $1,000 for about 2 hours of work. Also, senior healthcare consultants bill at over $800 an hour today. I've established a list price of $395 for the course. However, there's an introductory price of $99 for a limited time. If you're interested in taking advantage of this special offer, you can email me to reserve your copy. This will put you on the interested list. I will notify you as soon as the course becomes available. In consideration of this step, I'll email you my latest infogram on the U.S. healthcare system. There's no obligation on your part to purchase the course. I hope to hear from you soon. Thanks.